And we, of course, have many questions and answers now. We have Dr. Alok Patel, physician at Stanford Children's Health. Dr. Patel, thank you for joining us on the other side of the country here. We've been talking to you for how long now from opposite ends?
It feels like 2019 right now, Trevor.
That is... I never thought that would feel so positive, but I take that as a great compliment.
It's optimism, it's progress.
We all remember, 2019 a great year, 2020 not. Last winter was devastating across the board. We've done a whole lot of vaccinating since then. Do we still need to be worried with the numbers we're seeing?
I don't think we need to be as worried, Trevor, as last winter, but there's two things that are different. One good, one bad. One thing that's good is that we have nearly 60% of this country is fully vaccinated, so we are going to prevent a lot of deaths compared to last winter. But the big difference is that this has been the year of the Delta variant. And that's something people need to keep into account, especially as we see pockets of the country that are seeing upticks in cases right now, and that could get worse as we get into those colder months and families want to get together, travel, and hopefully not be around too many people who are unvaccinated, losing their masks and getting complacent. Is
the fact that we're seeing the rising infections and hospitalizations, especially in some states that have high vaccination rates, is that a sign that the immunity is waning with the vaccine?
I think partially. So remember, there's two things. There's something I want to differentiate. It's the positive cases and then symptomatic COVID-19. I'm less concerned about positive cases and people who are vaccinated, because the vaccine is going to work. They'll be protected against severe illness. But one thing that is concerning is that there is some waning immunity. There are still some cases of people who gotten immunized, who have not gotten immunized, who are now getting breakthrough cases. But we really are concerned about those people who are high risk, who may have been first in line to get the vaccine late last year, early this year, and now they've got plenty of evidence that the immunity is waning, and they should go out and get their boosters.
Pfizer's already asking the FDA to get authorization to get booster shots for every adult. Right now it's 65 and older. Some states, though, California, Colorado, they're saying don't even wait, go out and get it. What do adults need to be thinking about booster shots right now?
I think adults, if they have any reason to be concerned, should absolutely go out and get it. We've got the supply. There's resources available for you to run out and get a booster right now. And think about your situation, your own health, people around you, community you live in, where everyone's waiting to see the data from the 10,000-person Pfizer trial that actually shows that, hey, if you compare two groups of vaccinated people, those who got a booster have 95.6% greater vaccine efficacy compared to those who didn't get a booster. So the evidence is there.
Let's say there's a family, they believe in the vaccines, they got it early, and they followed all the instructions, but they have not gotten booster shots yet. Do they need to be concerned about getting together for Thanksgiving?
I would recommend that they would have a conversation about, do we need to get the booster shot, especially if they got it early, because now that's way more than 6 months, which is at the point when we start to see the immunity waning. So I would recommend that they go out and get the booster. If they don't, and they're all vaccinated, all the data suggests that they still have great protection against severe illness and or death, which is what the vaccines were designed to do in the first place.
Since we have you here in studio, I've heard from at least a few other doctors that the thing they're looking at is the COVID pill because it's a treatment once it's already here. What do you think, from your perspective, is like the thing that will put this pandemic to bed? Is there anything?
I don't know if we're going to putting the pandemic to bed means that we no longer have an uncontrolled global outbreak. I think one thing that we need to pay attention to is vaccine equity. We are talking right now about trying to get a 60% vaccination number higher in the United States, when if you look at sub-Saharan Africa, we're under 10%, 7%. And so we're not going to get anywhere until we actually get global distribution. We can't wait for people to get symptomatic COVID-19 and then say, but hey, we'll treat it. So I think that needs to be a big priority. Once we get all that squared away, we stop normalizing losing 1,200 Americans a day, then we can talk about the light in the tunnel.
It does put it in perspective, too, especially when, California says, just go get a booster shot now. We're fully stocked. When Africa has people who are begging to get the vaccine.
The WHO put out a report saying the 90 countries that are offering booster shots, none of them are developing or lower income countries.
Unbelievable.
It speaks volumes.
Dr. Patel, we appreciate your time. Thanks for coming in.
Thank you.
You're welcome anytime.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.